Home health versus home care, why it matters to know the difference for your loved one's care. Hi, my name is Dawn Bransky, and today we're going to talk about the differences between home care and home health. So let's talk about how service is initiated. With home health, it requires an order from your physician. The physician will give an order to a home health company, and their team will follow the doctor's orders. Home care is arranged by the family. So the family determines what care is needed to keep their loved one in their home, and they're dictating the care that we're providing. So let's talk about payment. With home health, the payment is typically through private insurance. That could be through Medicare or private insurance or another form of health insurance that your loved one has. Home care payment. Payment is typically private pay for home care. Long-term care also pays for benefits, and so does the VA. There is also a new program called the GUIDE program that Medicare has started, and they allow $2,500 a year for those suffering with dementia to be used for home care services. So who's going to provide the services that you arrange for home health versus home care? With home health, you're going to have probably a registered nurse, a physical therapist, an occupational therapist, a speech therapist, maybe a bath aide, a social worker, or a dietitian. With home care, you're going to have a caregiver. Now that caregiver could be an experienced caregiver or be a certified nursing assistant. But services are non-medical, so you typically do not see any other skilled clinicians. So the difference between the two services that you're going to receive with home health versus home care is with home health, you're going to have medical services. The nurse may be doing teaching for diabetes, they may be doing wound care, they may be doing some respiratory treatments, you may have your physical therapist teaching your loved one how to walk, but those are all skilled services. With a home care caregiver, we're going to be doing things like assistance with activities of daily living or instrumental activities of daily living like cooking, cleaning, laundry, or transportation. We can help with all of the things that are associated with activities of daily living like bathing, dressing, toileting, personal care, personal hygiene, grooming, incontinent care. So service delivery is quite different between home health and home care as well. So service delivery for home health, typically you're going to have a range of visits throughout the week. Maybe the nurse comes once a week and would spend maybe 30 minutes or less with your loved one. And the therapist would typically come a few times a week, and those visits are generally under an hour each. With home care, the family is dictating how much care your loved one needs. So we provide service typically within at least a 4-hour window of time, and the family determines what time that window starts and what time it ends and how often that is provided, up to 24 hours a day. So how home health and home care partner together. Home health, typically the nurse comes in and maybe your loved one has a catheter and they're doing some instruction to make sure that the catheter is emptied and clean, and the caregivers would provide that. If the catheter needed to be changed, that would be a medical treatment that the nurse would do. If they have therapists like physical and occupational therapy and they're performing home exercise programs, instruction can be provided to the caregiver so that the caregiver can ensure that those exercises are being completed on a daily basis. So in conclusion, home health and home care typically partner together, and we work together in the community quite often. So whether you're needing a medical treatment through a home health provider or a non-medical care through a home care agency, we can service you and recommend partners in the community to ensure that your loved one is getting the care that they need. To learn more about working with us, go to Benevolent Hearts Home Care at beheartshomecare.com.